This took place at Humanities University Hospital in Center City, Philadelphia. I'm not sure if anybody's familiar with It's Always Sunny in Philadelphia show. So when they drag people into the hospital in that show, they drag them to Humanities University Hospital. Humanities University Hospital is kind of like the stepchild hospital in Philadelphia because there's two huge major hospitals there, Jefferson Medical Center and University of Pennsylvania, two huge research hospitals. And we're right by Center City. So if I was across the street on 15th Street in the parking lot, I would see this was where Drexel's nursing school takes place and it's attached to the hospital. If I turned around in the parking lot, I could see William Penn, and this was where all our offices were for the health and science faculty. And we had the best view of William Penn from our windows. So we really were in Center City. Anyhow, my role at Humanities University Hospital, I was a faculty member at Drexel. I had a grant buyout. 20% of my time was bought out from Humanities University Hospital. So I was sold to the hospital for 1 day a week, basically. I was the research coordinator. When I got down there to take my position 3 years prior to coming here at Drexel, they said, Hahnemann's going up for magnet status, and we need a research coordinator, and it's a for-profit hospital. Magnet status is a designation given to hospitals for nursing excellence. So it was a big job, actually, but it was one of the most fun jobs I ever had. The significance of this project, which was only one of 18 that I ran that 3 years with staff nurses at Humanities University Hospital, was patient satisfaction, because administration is worried about that because it's now reportable and public knowledge. And guess who had the worst patient satisfaction in the city of Philadelphia? We did. So that was one of the goals, was to bring that up. Okay, the research project focused on questions: how do patients perceive the caring and appearance of professional nursing at Humanities University Hospital? Were easy to identify who the nurses were? That's a big problem in the hospital because there's so many interdisciplinary personnel walking around. And how do the nurses at Humanities perceive themselves? Do we think that we're caring? Do we think that our appearance is appropriate? Image in nursing is a complex problem. Actually, a buddy of mine from Philadelphia did her whole dissertation on the image of nursing. And if you want a good snapshot of the image of nursing, go into a cards section in a Hallmark store or in any store and start looking through Get Well cards. They range from angels of mercy to sluts. On cards. So it's more than just apparel, also here, the image of nursing. It's what the public perceives. We are perceived as the most trusting profession, actually the most trusting profession. It's also tied to patient satisfaction, our image. We did a review of the literature like we did for every one of our QA or our research projects. And our research projects there at Humanities were soft research projects for the most part of those 18 projects. I was dealing with nurses, 80% of them only had an associate's degree. So doing anything more than frequencies or t-tests was really difficult. Although we did get into some major multi-site projects, like in the ED, we got into a project that we were studying LWBSs, left without being seen patients, and see if we could decrease the rate of that, or increase the rate of them being seen quicker in the ED. So there were some big projects, but most of them were soft projects like this. Multiple variables in the literature were professionalism, the quality of care, job performance, and leadership. All these variables played into how people in the hospital perceived nurses. This was a replicated study. We found a tool online after administration, and what really started this off was administration said, our patient scores are down, you all need to wear white uniforms. And we said, what? Did you ever cross 15th Street in the slush? What are you thinking? Okay, so anyhow, this was a replicated study. It was an IRB approved, expedited study. All families that were physically able to speak English, and that was a deficit of the study because we had a multicultural population there, We did it over a 3-month period. We used 9 nursing units. It was a 16-floor hospital, so we picked out 9. We stayed away from psych. We stayed away from OB. We stayed away from peds. We stayed away from the, the MICUs and the SICUs and the ICUs. We just did basically the medical floors and the cardiac floors. Patients or families were asked on their survey to complete the survey. Nurses were asked to do the same survey with a little bit different wording, and then we just compared results. So it was fairly easy. And of course, this is a really old hospital because all the buildings are old in Philadelphia. So there is no tube system other than these. So we had to run up and down with the surveys and into every patient's room. So we collected 105 from patients and we collected 227. There was a good representation of ages in both nurses and patients. Better, of course, in patients across the spectrum than nurses because nurses at some point in time aren't running around the hospital too much anymore. All questions were on a Likert scale from 1 to 10, 10 being very strong. And this is our kind of where we're situated in Philadelphia. We are right here next to City Hall. So we service these communities, and it truly is a city of neighborhoods, Philadelphia. We service Chinatown, Old City, Northern Liberties, and the Third World that extends up here in Philadelphia. These neighborhoods, Rittenhouse Square, Washington Square, Society Hill, they go to Jefferson and University of Pennsylvania. We don't see those patients a lot. So we had a very mixed population. We have, being right next to Chinatown, we had Chinese patients. They spoke Mandarin, Indonesian, or Cantonese. We had a group of Albanian patients that came up from Northern Liberties, and a Russian population also. Plus, we had a large African-American population, and we were the bloodless center in the city because nobody else wanted that. So guess who we had? All the Jehovah's Witnesses. Because we were the bloodless center. So it was a very, very interesting place.
I don't understand what that means, I'm sorry.
Okay, bloodless medicine is like a new concept, actually. So because Jehovah's Witnesses don't take blood, it's against their religious beliefs. What we do in bloodless medicine is we do everything possible not to give them blood. They come in before surgery, we give them medications to increase their blood reduction, we take out their own blood so they can use their own blood. So everything that is possibly done not to give them blood is done at a bloodless. And actually, all hospitals should function on this premise. Because, well, this is my own opinion, but something tells me after AIDS broke out in this country, maybe the Jehovah's Witnesses were thinking something right. So anyhow, so that's the makeup of this kind of unusual hospital. Patients were pretty split gender-wise. Of course, nurses were not. Nurses at Hahnemann Hospital, right, there was only 18 guys that participated, and that's about the average ratio of men in nursing at this point in time. Patients' ages were across the span. Of course, you're going to see more younger nurses than older nurses. But we had a 74-year-old that was running around the hospital with a hat on, and every hospital has one. Yeah. So, God bless her. So, that was our makeup. The nurses at Hahnemann University Hospital were an exceptional group. Most of them were ADN graduates from 2-year nursing schools. They were white, Irish, Catholic. They came from the surrounding area when that's what the surrounding area was. I was going to say something else. They were the most resilient group of nurses I had ever met. They had gone through 2, not 1, 2 foreclosures on the hospital, bankruptcies. These gals came to work when they didn't have a paycheck and took it in Center City, Philadelphia, and just took care of patients until somebody bought the hospital and started to pay them again, not once, but twice. It was really very much an asset for me because anything I asked them to do, not a problem. They had seen it all, done it all, ran around that hospital, switched units, everything was like really not a problem. Great group to work with on this project, on these projects. Our nurse is easy to identify at Hahnemann Hospital. This was a 4-item concept. Patients could identify nurses better better than nurses thought they could. And one of the things was using this large RN tag in the hospital for nurses. The other thing was, it wasn't significant, but color of uniform. And I'll talk about that a little bit later. Concept 2 was caring and skill. 3 items were on this. Patients scored perceptions of skill and caring lower than the nurses did, obviously, and significantly lower, but they were both fairly high on the Likert scale. So, from these results, we developed another project with administration pushing us to do that, and it was called Back to Basics. Because patients perceive nurses' caring and empathy and hands-on care as more professional than they do if you know the right medication and you can take care of the IV pump and all the technical stuff. So we had to kind of switch that perception to what we give to the nursing assistants always to do, maybe take some of that back ourselves and do it so they can change perceptions. Okay, that was another project. Okay, concept number 3 was appearance. There were 6 items on this. Patients rated the nurses higher for looking professional significantly than we rated ourselves. So there was a lot of answers that the nurses gave that they didn't think that their peers really looked professional. Some of the things was earrings, bracelets, hair, nails. They were not such a bother to the patients. Then we got to the white uniform question, the dreaded question. Patients said nurses significantly more often should wear white uniforms than the nurses did, but both were on the bottom end of the scale. So we skirted that issue with administration because they were both below the 5 on the Likert scale. So we said, you know what, it's really not that important to anybody. So we did some other things instead of that identification. The implications we took from this is, yes, the large print tags help. We definitely had to follow up on the skill and caring and how patients perceived us. Long hair, nails, earrings, the things that we worry about most often was not really a problem for the patients. They were more of a problem for us, the nurses, because we were taught in nursing school that those things were unprofessional. White uniforms were not the strongest indicator of appearance. Colored uniforms, we had a long talk about that, and I think we were moving towards a specific color of uniform. Think about the population in the hospital, the geriatric populations in the hospital. They might be better identify somebody by the color of their top. And I've heard that from patients. Oh, my nurse with the red top with the flags on it. Oh, my nurse with the orange top with pumpkins on it during Halloween. So that might be more of an identifying piece for people than if everybody was in white. That might be confusing as people age. Then the next study that we're going to publish about image is about how nurses perceive patients, how nurses with tattoos are perceived by patients and by other nurses. The study is done. It's out for publication. It should appear any month now. Dr. Gettings helped me with it. And the poster child that we used with the tattoos is my niece who works in ICU at Hahnemann University Hospital, who has a full sleeve and something else here. And it was a very interesting study, and actually it's more of a problem for nurses than it is for patients.